Welcome to Health Facts with Normani Ricks. I am your host, Normani Ricks. I like to start off each episode with a little known health fact. Did you know that 80% of chronic illnesses stem from metabolic diseases? Did you know that 2 out of 3 of the top killers in the United States are heart disease and diabetes, which stem from metabolic disorders? I have the honor and pleasure of having Dr. Philip Ovadia here today to speak to you guys and educate you guys about heart health and metabolic disorders. He is a cardiac surgeon by practice, and he is the owner of Ovadia Heart Health. Welcome to the show. How you doing?
I'm doing great, Normani. Thank you for having me on. Those were some great facts that you started off with there, and I think we'll get into some even more interesting health facts for the audience.
All right. So, Dr. Ovadia, tell us about why you decided to become a cardiac surgeon.
Sure thing. I always knew growing up that I wanted to be a doctor, and actually I always knew I wanted to be a surgeon. Although I'm not quite sure why I wanted to be a surgeon, it was just something I always knew. And then as I went through, the educational process, as I went through college and medical school, that only got reinforced. I loved the kind of, hands-on approach for surgery and the, results that it provided pretty, quickly. You knew whether a surgery was successful or not typically. And, I started my training in surgery, and ultimately I came to heart surgery. The combination of the technical aspects of doing heart surgery and the physiology of heart health was just always so fascinating to me that I loved heart surgery.
Okay, so something you just said spoke to me. I'm an occupational therapist, and people always ask what setting do I like to practice in the most. There's options like acute care, home health, inpatient, outpatient. I love doing outpatient because you get to see the outcomes of what you did quicker and faster. And you know that, okay, the person walks in, they get therapy, and then they walk out and they're a new person. So it's kind of like the gratification of knowing what you did was successful. So I love that.
Yeah, definitely. What I have come to realize, I went through my career now after 15 years and doing thousands of heart surgery, I have come to realize that, there is more power in preventing disease than treating disease, however. And so that is a new aspect that I focus on in my career now as well.
So, Dr. Ovadia, one thing that I saw that makes you very, very different than other surgeons is you had a lot of weight to lose yourself, and you've lost over 100 pounds, and now you're heart healthy. So can you talk about your journey to weight loss?
Sure thing. I was obese my entire life. Growing up as a child, I was overweight, and that was despite the fact that my family largely followed, the mainstream advice. We ate according to the, food pyramid, the U.S. dietary guidelines. We avoided sugar. I have an older brother who's a type 1 diabetic, so we really never had sugar in the house. We ate all of what we were told were healthy grains. We used low-fat, milk and margarine instead of butter, and vegetable oil and all of those things that we were told would make and keep us healthy. I was also very active as a child. I was always playing sports, riding my bike, walking everywhere. And despite that, I was overweight as a child, and it got worse as I went through college and medical school. I became more and more obese. A number of times, especially as I got into medical school and beyond, I, tried to lose weight. I did what I was taught in school. I ate less, moved more, counted my calories, and ate a low-fat diet. And I would have some short-term success, but I always gained back the weight and more. And thankfully, about 5 years ago, I found myself at a spot where I was morbidly obese. I was pre-diabetic, And I realized that I was going to end up on my own operating table, so to speak. I was headed down the same pathway that the patients I was taking care of, had followed. And thankfully, I was able to come across some different ideas about why we get obese, why we get unhealthy. Ultimately, I came to learn about the importance of metabolic health, and that the types of food that we eat are more important than the amount of food that we eat. And I've been able to use that personally to successfully lose over 100 pounds and now keep it off for 5 years. And I now use it with my patients to help them overcome the same challenges and, hopefully help them to avoid those chronic diseases that you mentioned when at the opening: heart disease, diabetes. I would add in many forms of cancer, Alzheimer's disease. All of these things have been tied to poor metabolic health, and I think are largely reversible and preventable.
So, Dr. Ovadia, what about stress? Do you think stress leads to a lot of weight gain? Because I know that a lot of people, when they're going through their school, their education, especially if you're getting a doctorate degree, a lot of stress kind of puts weight on you. Can you speak to that?
Yeah, I think stress, plays a role in metabolic health in a number of ways. We know that there are direct effects from stress. Some of the hormones that it influences within our bodies will make us more prone to gaining weight and to becoming more metabolically unhealthy. And then we also know that people who are under stress tend to pay less attention to healthy habits like what they're eating and exercising and getting enough sleep. So both directly and indirectly, stress plays a large part in our metabolic health.
So I think it's cortisol that's the stress hormone, correct?
Correct. Cortisol is probably the main stress hormone, and there are a few others. And again, cortisol has some direct and indirect effects within the body that are going to tend to worsen metabolic health.
Right. What about the role that genetics plays?
I think in the end, genetics actually plays a fairly small part in metabolic health. We tend to think that, things like diabetes and heart disease run in families, but a lot of that is because families have the same habits, and habits get passed down generation to generation. So families tend to eat the same foods and lack of exercise and all of these habits that worsen metabolic health. While there are some genetic causes or genetic alterations that can get passed on that can make people more prone to poor metabolic health and to chronic medical problems. Ultimately, I think improving your habits around metabolic health are always going to be able to improve your situation. Genetics plays a small part, but it doesn't determine your destiny as many people are led to believe.
Okay. So talk some about the 5 markers of metabolic health.
Yeah, I think there are 5 basic markers of metabolic health that we use, and these are essential that everyone knows where you stand in relation to these markers. Also understand that these are just the basics, they're just the starting point, but at least if people knew these 5 metrics, it would get them, kind of tuned in and focused on metabolic health. So the first metric we look at is your waist circumference. You can measure this at home. You take a tape measure just above the level of your belly button, and it's best to measure it first thing in the morning. And if you are a woman, you want that to be less than 35 inches. If you are a man, you want it to be less than 40 inches. The next metric we look at is your blood pressure. Again, you can measure it at home. You can get it measured at the doctor's office. You can go, usually to any pharmacy or grocery store these days and get it measured. And you want your blood pressure to be less than 130/85. Okay. Both of those numbers, the top number less than 130, the bottom number less than 85, and that needs to be without medications. So if you've been started on medications to lower your blood pressure, that is a sign that you are not metabolically healthy. Okay. And importantly, high blood pressure is oftentimes one of the first signs of poor metabolic health. And it doesn't get recognized as such by many physicians and many people. The other three measures all require getting a blood draw, getting some blood work done. Your fasting blood glucose level. So that's the amount of sugar that's in your blood when you haven't eaten for about 8 to 12 hours. And you want that to be less than 100 milligrams per deciliter. And again, that needs to be without the use of medications. Okay. And then finally, we look at some cholesterol numbers. We look at your HDL cholesterol, what's oftentimes called good cholesterol. Right. And as the nickname sort of implies, you actually want more of that. Everyone thinks that you need to lower cholesterol, but HDL cholesterol you want to be higher. And specifically, if you are male, you want that to be over 50 milligrams per deciliter. I'm sorry, if you are female, you want it to be over 50 milligrams per deciliter. If you are male, you want it to be over 40 milligrams per deciliter. Okay. And the final number we look at also from your cholesterol panel is the triglyceride level. And you want that to be lower, less than 150 milligrams per deciliter. So those are our 5 basic measures of metabolic health. If more than 3 of those are not in the healthy range, it actually diagnoses you with what we call metabolic syndrome. And that means that you are at very high risk for developing heart disease, diabetes, Alzheimer's disease, and many forms of cancer. If 1 or 2 of those are abnormal, it's a warning sign, because we know that people that have 1 or 2 abnormal are likely to progress to having 3 abnormal and metabolic syndrome within the next 5 to 10 years. And then, if all 5 of those are in the healthy range, that should be your goal. But realize that in a recent study, 88% of adults in the United States did not meet all 5 measures of metabolic health.
Wow.
So, said another way, only 12% of adults in the United States are considered metabolically healthy by those criteria.
Wow. So when we go to our primary care physicians, what tests do we need to ask for to get ran so we can make sure that we're keeping track of these 5 markers?
Yeah, so again, really all you need is a fasting blood glucose level, which most doctors check as part of a routine physical examination, and your cholesterol panel, your lipid panel, it's called. And again, most doctors check that. The problem is that most doctors don't look at those numbers in the way that I framed it. They don't look at it as 5 markers of metabolic health. Most doctors, when they look at a cholesterol panel, only pay attention to what we call the bad cholesterol, or the LDL level. And that's not one of the markers of metabolic health. And then, most physicians look at a fasting blood glucose and only worry about it when it gets into the diabetic range, which is usually over, 120 or so. Okay. So they don't pay attention to it in the right way, and they don't tie it back to the blood pressure, the waist circumference, which really almost no one checks, no physicians check, and they don't properly put it together to figure out if people are metabolically healthy or not.
So basically what you're saying is we need to take control of our own health, and we need to ask for those lab tests so that we can look at them ourselves and look at the numbers.
Exactly. And, I also tell people that if for some reason your doctor won't order them for you, there are actually many websites these days that you can go to and order these labs yourself. And checking a fasting blood glucose and a cholesterol panel at many of these sites is going to be, $20 or $30 to get those things checked. So it's not expensive. It's just a matter of, the healthcare system, I think, doesn't focus enough on preventative efforts on keeping people healthy. We are too focused and, quite frankly, too busy taking care of people once they get sick.
Right. So what type of heart surgeries do you do the most?
So the most common heart surgery that I do is what's called a coronary artery bypass grafting. And this is the most common heart surgery done in the United States. And that's to deal with people who have developed heart disease develop blockages in the arteries on their heart. So this is what we call atherosclerosis. This is what leads to people having heart attacks in most situations. And it is a chronic progressive disease. It doesn't come on all of a sudden. There's usually years beforehand that if we are looking at the right things, we can tell that people are on their way to developing this. And again, this is where the metabolic health markers come into play, because we know that many, people will develop metabolic syndrome as much as a decade before they will develop advanced heart disease that leads them to, needing an operation.
Wow, 10
that,
years?
10 years. And quite frankly, there are even some other blood markers that can be, can show abnormalities even sooner than that. So again, if we're looking at the right things, we can realize that someone is on their path to developing heart disease or these other chronic diseases, and we can make changes and stop that from happening.
Okay. Dr. Ovadia, so you offer like telehealth and coaching for diet and how to stay heart healthy on your platform?
Correct. There are a number of ways that I can work with people and I can get this information out to people. First and foremost is my book, which came out recently. It's called Stay Off My Operating Table. It's widely available on Amazon and all the other platforms. And that has, a lot of the information that I talk about regarding metabolic health. Okay. And then I do have a telemedicine practice that I see patients throughout the United States. I work with them one-on-one on these issues. This can be people who are looking to prevent these problems from occurring, or these are people who already have problems like diabetes and heart disease and are looking to, minimize the impact from it, prevent more damage from occurring. And I work with people at all stages on that. So people can come to my website, ovadiahearthealth.com, and get information about that.
So you also talk about the 7 principles of heart health, correct?
Correct. The 7 principles of metabolic health.
Okay.
Ultimately, I think metabolic health is the most important thing to focus on for heart health. And the added bonus is that by focusing on metabolic health, we're not only addressing heart health, we're also addressing all those other things you mentioned: diabetes, Alzheimer's disease, cancer, most of the chronic problems that plague our society. Mm-hmm. And in the book, I outlined 7 principles that are the, kind of foundation for improving your metabolic health.
Okay. Great. So, Dr. Ovadia, what is your why? Why do you do what you do?
Ultimately, the reason that I became a physician and my why is because I want people to be as healthy as possible. And, again, this ties back to my personal journey. I was unhealthy. I was following the mainstream advice, and I remained unhealthy. And I see that so much in our society. So my why is to get this information into the hands of people, into the minds of people that need to hear it and understand it so that they can remain healthy. I would much rather prevent someone from needing me as a heart surgeon than dealing with them as a heart surgeon. I feel blessed that if people need heart surgery, I'm able to offer that to them. But ultimately, I would much rather prevent them from needing heart surgery in the first place.
Yeah, I feel like a lot of people, especially in the United States, are frustrated because, like you said, they follow the guidelines, they take out sugar, they drink low-fat milk and all of these things, and, they're still obese. So what kind of food would you recommend, or what kind of diet would you recommend people following to stay heart healthy?
Yeah, so, one of those 7 principles I talk about regarding metabolic health is to eat whole, real food. Okay. I think first and foremost, if people are going to kind of follow one rule, It's eat whole real food. And what that means is that you should eat the things that grow in the ground and then eat the things that eat the things that grow in the ground.
Okay.
Basically animals and plant products.
Mhm.
The one thing we know for sure, there's a lot of debate around what the healthiest diet is.
Right.
But there is, I think, no real room for debate that eating processed foods, the further away we get from eating these whole real foods, the worse our health becomes.
Right.
And so I tell people, first and foremost, eat whole real food, eliminate processed foods, and that is what is going to make you healthy or keep you healthy.
So that kind of sounds like the paleo diet, but we don't really want to call it a diet, right?
Well, it can take many forms. And one of the things I go through in my book is, a lot of the popular diet plans of today, literally both vegan and carnivore, paleo, low carb, Mediterranean, Atkins, all of these things, can be done in a way that make them metabolically healthy.
Okay.
But they also each have their pitfalls that are going to make them not metabolically healthy. And I think when we focus on metabolic health first and foremost, and we measure these, like you said, I don't like to call them diets. I like to call them, ways of eating. But when we measure these ways of eating against, are they making you metabolically healthy or not? I think that is ultimately what is going to lead people to success and allow them to, maintain their successes.
Okay. So who is the number one doctor who's going to look at metabolic conditions? Like, who do you recommend that people should reach out to find out if they're metabolically healthy?
Well, this is the problem. One of the problems that we have with the healthcare system is that there really aren't metabolic health specialists. It crosses all specialties. The heart doctor should be concerned about it because it is a primary cause of heart disease. The endocrinologists who treat diabetics should be worried about it. And family physicians, primary care physicians should all be worried about it. But because we focus so much on the diseases that result from metabolic health, and those diseases are all in different specialties, ultimately, oftentimes it's hard to find a doctor that is focused on metabolic health. So, one of the organizations that I am a part of is called the Society of Metabolic Health Practitioners. I recommend people go to their website. They have a directory of physicians who are focused on metabolic health, and hopefully you'll be able to find one in your area that you can work with. But even if you're not, get the book, read the principles, and just discuss those with your doctor. Go to your doctor and say, where do I stand on these 5 measures? And that can get the conversation moving in the right direction.
Okay. Dr. Ovadia, how can we find you on social media and on the internet?
Yeah, so I am most active at Twitter, and I am at iFixHearts. And then you can also find me on Instagram at Ovadia Heart Health. And finally, my website, ovadiahearthealth.com. So that's OVADIA hearthealth.com, has all of the links to everything I do.
Okay, awesome. Well, it has been a pleasure. Thank you for educating us. And I think what I got from this is you have to take your health into your own hands.
Yeah, that's a big part of my messaging is that, you can't rely on other people to keep you healthy. You need to take charge of your health.
Well, congratulations on losing 100 pounds and keeping it off.
Thank you, Normani, and thank you for everything you're doing to help people focus on their health and get healthy.
All right. Thank you so much.